Good morning, the respected delegates. Today, my topic of presentation is ocular tuberculosis, its proportion and socio-demographic profile among all types of tuberculosis. As we know that ocular tuberculosis has got diverse presentation and we need for high index of suspicion to diagnose it. This study was taken with the aim to detect the prevalence of ocular tuberculosis patients among all tuberculosis patients along with their socio-demographic criteria. Recently, the classification of ocular tuberculosis has been laid down by the ICMR and Central TB Division. The signs of ocular tuberculosis has been regarded as presumptive ocular TB, and if they are associated with some extraocular manifestations of other form of tuberculosis, and there has to be one immunological evidence, then we stamp it to be a clinically diagnosed ocular tuberculosis. With this mind, we have examined in the last 1 year 170 newly diagnosed tuberculosis patients for the presence and signs of ocular tuberculosis, and finally the magnitude of clinically diagnosed ocular tuberculosis was worked out and SPSS 20 software were used for the data analysis. These are the some results of the socio-demographic profile, and we see there has been most of the patients were male and they are unskilled worker, and most of them were below 10 standard of education. Out of 170 cases, we have 12 cases of clinically diagnosed ocular tuberculosis, and among 12, 10 has been associated with extrapulmonary tuberculosis and 2 has been associated with pulmonary tuberculosis. These are the several clinical photographs of our cases. And we know that from our study, there is a high prevalence of ocular tuberculosis, that is 7.1%, which is more than any other study from India. It is mostly due to our active screening of all the tuberculosis patients. And we know that uveal involvement in tuberculosis is the most important sign of ocular tuberculosis, and the choroiditis has been associated with immune-mediated hypersensitivity reaction. And the choroidal tuberculoma is itself an active tubercular infection. The choroidal tuberculoma has been associated as high as 34.6% with other forms of tuberculosis, mostly the intracranial granulomas or tubercular meningitis, as we have the case number 4, having bilateral choroidal tuberculoma with associated miliary tuberculosis that signifies the early dissemination of disease. The tubercular retinal vasculitis has been regarded as delayed type of hypersensitivity reaction, and we have the 11 number case has got anterior and intermediate uveitis that is associated with tubercular hypersensitivity reaction. But contrary to the previous belief, the Ehrlich disease recently diagnosed to be an infectious one because Mycobacterium tubercular DNA has been detected by the PCR from the vitreous fluids of the Ehrlich disease. There has been several recommendations of several societies to diagnose the ocular tuberculosis early so that we can have the pre-treatment visual assessments of tuberculosis patients and dilated fundus examination so that we can pick up them and treat them early. The strength of our study is that the study is unique in nature, that we perform the active screening of all the tuberculosis patients. And the limitations are being a tubercular endemic country, we have 170 cases. And I conclude my presentation that though tuberculosis is rare, but it can be vision threatening, and that urgent research is needed for the large sample size or community-based study to study the ocular tuberculosis. These are my references and acknowledgement. Thank you for your attention.